And we wish to express our profound gratitude to Admiral Levine, Rear Admiral Collins, and the entire HHS family for this recognition and life-changing opportunity you have afforded our public health youth ambassadors.
We're at the headquarters of the Health and Human Services Office of Minority Health, and what's taking place today is a fabulous ceremony honoring the young people, the young graduates of the Fairfax County Health Department Public Health Youth Ambassador Program.
We are formally acknowledging the accomplishments that you have made through the Advancing Health Literacy Program, and you've done it in a way that is unprecedented, long word, but an important word. The Office of Minority Health had a vision, and the vision was translated into a grant opportunity. Your families, your community partners, your political supports across your county said yes to the vision, but you, each one of you, made the vision a reality.
It's a program that is specifically designed and geared towards high schoolers in Fairfax County from communities of color. That means African American, African immigrant, and Hispanic students. They embark on a journey, a curriculum and field or practicum experiences of over 161 hours, and they get direct hands-on experience. The curriculum was developed by Morehouse College of Medicine, so that when the students graduate, they have a certificate from a medical program. And it teaches the students everything from interfacing in community and in work in communities of color to bring about public health practices. All of our graduates are required to do a capstone project centered around community health. So you'll see variations, everything from what they think at their age about solutions for mental health in their own communities in a culturally competent way. The beauty about this program, it takes the spark that's in a young person's heart about their own future, and what we do is we come around that spark and create a flame that will cast a light on their future. The goal is to help that young person reach their goal that they've set for themselves, whether it's educationally or if they want to track directly to career. Our job is to help them to track either to college or university or to career of their choosing, but with the hope, or at least give them the opportunity to come back to their communities and do something good for their communities. It's one hand up, and then continue to have one hand up in our communities of color.
My goal is to attend medical school and graduate to become a pediatrician or just a general doctor in general. I want to help create a change in the world, in the healthcare system, and improve the healthcare system in general.
My project is on sickle cell, and my plan is to create an educational convention for specifically African Americans or anyone who's thinking of having children to come and learn more about sickle cell disease and how people contract it. After high school, I'm hoping to go to college to study pre-med because I want to go to medical school and hopefully become a surgeon, specifically in neurology and oncology.
This is a pilot program. Right now the students receive a $500 scholarship for completion of the program, and then they also receive a laptop. They also receive medical equipment like blood pressure cuffs and thermometers and those sorts of things that they actually utilize. The beauty is they utilize them in their own families, and then that data that they capture in their own families, we have a database that they can actually track the progress in their own families. As you can see, that's a wealth of opportunity for one, that student can actually see in a practical way how they themselves can impact in public health in their own families, and then they can magnify that or think about the process of magnifying that across their own community.